How much vitamin D should I take? This is a question I get asked all the time by clients, and without knowing their exact vitamin D levels, it's impossible to answer. You may have heard that vitamin D is important, that low vitamin D can affect bone health, immune health, and that most people may be deficient. So some people start taking 5,000 or even 10,000 IU every day, sometimes for years, without ever checking whether they actually need that amount. On the other side, some people might test low for vitamin D and they take vitamin D for a few months, retest, find out their levels are now in the optimal range, so they just stop completely and their levels fall again. Without testing, you have no idea how much you actually need. So in this video, I want to answer 3 questions. How much vitamin D should you take? How much is too much? And what you should do to test so you're not simply guessing. The first point is that there's no single vitamin D dose that is right for everybody. 2 people can take exactly the same dose and end up with very different blood levels. I have clients taking more than 5,000 IU every day, and they're still only around 50 nanograms per milliliter. So they're in the optimal range with a high dose of vitamin D. Another person may maintain a similar level with a much lower dose or not even need to take vitamin D at all. Your response to vitamin D depends on your starting levels, sun exposure, where you live, skin pigmentation, digestion, medications, liver function, and especially your genetics. Variants in genes like CYP2R1 and the VDR gene can change how your body responds to vitamin D. That's why people can have the same dose and get different results. I've made a separate video on vitamin D and genetics, and I'll leave a link in the description. If you've ever taken a high dose of vitamin D and you've still tested low, let me know in the comments. It's more common than you think. That is why a better question is not how much vitamin D does everyone need, it's what dose do I need to maintain optimal levels. And the main test that you need to do is the 25 hydroxy vitamin D, often just written as 25 OHD. This is the primary blood marker to assess your vitamin D status. In the US, the results are normally reported in nanograms per milliliter. In Canada, Australia, UK, and other countries, it's usually reported in nanomoles per liter. To convert nanograms per milliliter to nanomoles, multiply by 2.5. So 50 nanograms per milliliter equals 125 nanomoles per liter. The minimum vitamin D on a lab test is 20 nanograms per milliliter or 50 nanomoles per liter. However, the minimal number does not always mean the optimal level. And in my practice, I commonly aim for around 50 to 60 nanograms per milliliter, which equals around 125 to 150 nanomoles. And this depends on the individual person, their bone health, gut health, and immune function. And there's no proven advantage in pushing levels much higher. It's also important to distinguish between correcting a deficiency and maintaining the result. Someone who starts with a very low vitamin D may need temporarily very high dosages. But once the level improves, they can reduce that down to a maintenance dose. This is where people can often make a mistake where they either keep doing their correction dose at very high levels, or they get to the right dose and then just stop taking vitamin D altogether and the levels just slowly decline again. A better approach is to correct the deficiency and then retest after a few months to make sure that your levels are still in the optimal level at the maintenance dose. Personally, I supplement with vitamin D only in the winter. I've been testing over many years and I find that I get enough from the sun in the summer, but in the wintertime I have to supplement to keep those levels at the optimal range. Someone else may remain low during the summer as well. My wife is like that. She used to drive boats to the Great Barrier Reef. You couldn't have a job with more sun and she was still low in vitamin D. Testing takes out the guesswork. One reason that testing is valuable is that low vitamin D can often cause no obvious symptoms. Some people may experience muscle weakness, muscle aches, cramps, even bone pain, but these symptoms are non-specific and can be caused by so many other things. And bone health is not the only reason why you need vitamin D. Low vitamin D has been linked to reduced immune resilience, so more frequent colds, flus, things like that. Low mood, especially in winter with low sun exposure, muscle weakness, and an increased risk of falls in older adults, independent of bone density. And there's a higher likelihood of autoimmune conditions with low vitamin D, such as multiple sclerosis or even type 1 diabetes. Most of this research is observational. It shows an association, not proof that correcting vitamin D is going to fix all of these problems, but it is part of the solution and one more reason why you want to test and not guess what your levels are like. The bigger concern with bone health is what happens over time. Vitamin D helps your intestines absorb calcium, and this supports bone density. And when vitamin D is low, calcium levels in the blood stay exactly the same because parathyroid hormone rises and that draws calcium out of the bone, keeping the blood levels normal but increasing bone density problems. By the time someone is diagnosed with substantial reduced bone density or experiences a fracture, bone loss has already occurred, and prevention is much better than trying to fix a problem after it's occurred. And vitamin D toxicity is different from simply exceeding the recommended daily intake. The recommended upper limit of vitamin D supplementation is 4,000 IU a day. That does not mean that if you take 5,000 or 10,000, you're taking toxic levels. And some people may need these levels for a defined period to boost their levels up into the optimal range. But it doesn't mean that you should be taking these higher dosages long-term without testing. And true vitamin D toxicity usually causes problems because excessive vitamin D drives calcium levels too high in the blood or the urine. And that can lead to nausea, poor appetite, excessive thirst, frequent urination, weakness, confusion. And these can also be caused by other symptoms, other problems as well, so testing helps understand why it's happening. Toxicity is normally associated with very high levels, usually around the 150 nanograms per milliliter, which is 375 nanomoles per liter. That does not mean that below that dose is desirable. You don't need to reach poisoning territory before a dose becomes unnecessarily or potentially harmful. A 3-year trial compared doses of 400 IU, 4,000 IU, and 10,000 IU every day. And the higher dose groups did not have better bone density. Instead, they experienced greater loss of volume of the bone. And the biggest loss was occurred in the 10,000 IU group. So the idea that more is better does not ring true. And that's why it's best to test and not guess. Doctors don't always test for vitamin D as a routine part of your CBC or CMP. Often this is something you have to ask for or organize yourself directly through a lab. Testing becomes much more informative once you've done it over a few years and you can understand what your levels are like at the end of winter and also at the end of summer. This can help to understand how you should supplement. And the testing helps you make a personalized decision whether you need 1,000, 5,000, or even 10,000 IU a day to maintain your bone density. So the main test you want to do is the vitamin D 25 hydroxy. But you also may want to check from time to time other markers like parathyroid hormone. Parathyroid hormone is on the lower range. That generally means your vitamin D levels are great. If it's higher, you may need more vitamin D. So here's the main takeaway. Don't choose your vitamin D dose based on what you've read online or if everyone says you need 5,000 a day or 10,000 a day because you have a particular health condition. More vitamin D doesn't fix it, but having low levels can contribute to the health condition. So you just want to make sure you have the optimal level and not excessive amounts. The goal is not to take the highest dose possible. The goal is to maintain an appropriate vitamin D level using the lowest dose that gets you there. If you're taking a high dose and you've never been tested, this could be a good time to retest to see where your levels are actually at. Let me know in the comments, have you ever tested your vitamin D and you were surprised by your result?